Welcome to Hello Therapy, a podcast to help you take charge of your mental health through evidence-based psychological tips and tools straight from the therapy room so that you can live life better. Imagine finding yourself in a world you never expected, surrounded by beeping machines, unable to hold your newborn, and overwhelmed with uncertainty about what comes next. This is the reality for parents whose baby requires neonatal care. Today I'm joined by Dr Frankie Harrison, a clinical psychologist and mum who has experienced firsthand the complexities of neonatal intensive care. Together, we explore the emotional challenges of the NICU journey, its impact on mental health, on parenting, and the often overlooked experiences of non-birthing partners. With both professional expertise and personal insight, Frankie offers an invaluable perspective on navigating the NICU experience and its lasting effects on family life. So let's dive in. Hi, Frankie. Thank you so much for joining me on the Hello Therapy podcast.
Thank you for having me. I'm really happy to be here.
I'm really excited about our chat today because I'm going to be talking about NICU and parenting and neonatal care, and basically a topic that I haven't had much to do with in my professional career. So it's going to be so interesting to get your insights. But do you want to tell our listeners who you are and what you do, first of all?
Yeah, sure. So I'm Frankie. I'm a clinical psychologist and I'm a parent who's been through neonatal care, which is what I support other people with now. So I qualified in 2017 and originally specialised in working with older adults in the NHS and the third sector. But then things kind of changed for me. So I became pregnant in 2019 and my baby was delivered by emergency section at 31 weeks, so 2 months early. And then I just found myself in this world of neonatal care. I knew nothing about it. It felt completely terrifying. It felt like I had no knowledge, no understanding of what was going on. I felt really out of control. And that experience, it feels like it kind of changed the path of where I was going, both personally and professionally, really. I met another person called Georgie, another mum. We met online, we met on Instagram during the pandemic. And we decided that being mums ourselves, having gone through the experience, and me being a clinical psychologist, her being a graphic designer, having all the techie bits and the design stuff, that we could create something together. So we started a page called Miracle Moon on Instagram, and it's just kind of grown from there. Originally, it wasn't set out to be a business or anything. It was just a page where we were just kind of validating the ways that some people might be feeling. And it's just grown and grown from there.
Yeah.
And now we want to provide information that is real, that's validating, that's trauma-informed, that's educating, to kind of help people understand the experience of neonatal care.
Yeah. And that's what I love about your social media. It is so validating for someone going through it. So, and also really interested in that you work with older adults, because I worked with older adults for 13 years in the NHS. So that's really
I
interesting.
loved it. It was hard work though,
Yeah.
because it was a lot for not a lot back. It was really, really difficult, but it was my absolute first kind of passion working with older adults. Yeah.
So can you set the scene for us? So what is NICU and why is it important to talk about it?
So NICU is Neonatal Intensive Care Unit. That's what it stands for. It is quite often a place that no one expects to be. The majority of the people who are there are not expecting to be there, either having a premature baby unexpectedly or having a full-term and sick baby and not realizing that you're going to need it. Some people have some advance warning, but the majority don't expect to be there. 1 in 7 babies need neonatal care.
Wow.
And 80% of parents struggle with their mental health after neonatal experiences. So for me, I like those numbers, when I first heard them, shocked me with how many. So if you think about your standard antenatal class, that's maybe like 1 to 2 within a class.
Yeah.
Right. But yet it's not spoken about. It's not
Mhm.
spoken about in kind of antenatal education or in any kind of way. I also don't think people realise that NICU means intensive care.
Mhm.
So if you were to say, you know, a parent or a family member was in intensive care, the majority of people would be like, oh my goodness, that's awful. Like, I
Yeah.
understand the gravity of that. But when you say NICU or neonatal intensive care, for some reason, it's just kind of, I don't know, maybe it's because they're little babies. I don't know what it is, but people don't really understand the gravity of what that actually means.
Yeah.
But we need to be talking about it, because people kind of go into it and they have so many of these feelings and these thoughts, and for so many people they feel so alone in it. And I think that's why we're seeing so many people struggling with their mental health afterwards, because they're just not getting the support, the validation, the understanding that they need.
Yeah. And you said so 80% of parents have mental health challenges, which, makes sense. Can you talk us through sort of what some of those challenges might be, or the kind of things that you see or have seen in your practice?
Yeah. So, I mean, all perinatal mental health issues for mum and for dad are more common in parents with NICU experiences, by a much bigger percent. Kind of, so I see kind of all of the, what you would normally see in a perinatal mental health service, I guess.
Okay.
But I guess the thing about the NICU experience is it feels like it's this kind of perfect concoction for this mental health struggle afterwards. So you're immediately separated from your baby. There is potentially risk to your life, to your baby's life. It can feel really out of control and uncertain and unsafe. But then equally, the NICU gives you routine and this kind of odd sense of safety, even though you don't feel safe at the same time. There's threat all around you, medical intervention, monitors, beeps and alarms that are meant to keep you hypervigilant. You're being told what to do, when to do it. There are other babies around you that might be sick or maybe even dying around you. And then you have to leave and you have to go home, and then that's all gone. But your baby is still vulnerable or sick. But there's no monitors, there's no more support, there's no more routine, there's no more kind of safety in that aspect. So what we then see people experiencing afterwards, I feel like is really understandable.
Yeah.
So you'll see people who are doing that kind of anxiety bit where they're reaching for control or certainty in some kind of way. Like, of course they're doing that. They're doing the checking, the monitoring, the reassurance seeking. Of course they're doing that. There's this hypervigilance that's continuing to be there because their baby is no longer being monitored. So it's this kind of like preoccupation with their health, that anxiety around their health, which we see a huge amount. I see a huge amount of people with PTSD. So research, again, it's between 40 to 70% of parents experience PTSD after neonatal care. So huge, absolutely huge numbers. And I actually, I think it might be in those higher numbers, because a lot of people come to me from a GP who's told them it isn't PTSD. And actually through doing the assessment and talking to them, I'm like, okay, it is PTSD, But I think that there's a lack of education around what PTSD actually is. We have a lot of people who come in with a huge sense of guilt and self-blame. And I think that often comes from people having so much uncertainty. I don't know why my baby came early. I don't know why they were born sick. And people often land on that feeling of like, it might have been something that I did. Did I cause this in some kind of way? Because that uncertainty feels really intolerable. We have a lot of people who experience a huge amount of grief, either because they have lost a baby or because they've lost the experiences that they thought they would have. But I guess the most common thing that I guess people maybe wouldn't realise, and this is why I think a lot of parents get missed in perinatal mental health services, is because there is often a delayed onset. So parents will kind of go home and they're still in that survival mode. And they've maybe had their baby alive for weeks, for months, and then they go into that survival mode. They keep doing that kind of functional freeze, keep going, keep moving, keep doing. And it isn't until normally around that kind of 9 to 12 month mark where you're thinking of returning to work, starting childcare, your baby's birthday, all those kind of things, that is when a lot of people suddenly go, what is it that I've been through? We might kind of see that delayed onset PTSD, getting flashbacks around that time of the birthday.
Okay.
And a lot of perinatal mental health services kind of stop at one in terms of support. So I think that NICU parents often get missed.
And is there any liaison that happens? So once parents move out of NICU and take baby home, is there, obviously there's midwives, but is there any kind of transition there? Any
In
support?
terms of mental health support?
Yeah, or any support?
Very rarely. I mean, physical for the baby,
Yeah.
So the baby might continue to have kind of physical health issues or appointments and stuff like that. Often the focus is on the baby.
Okay.
But in terms of the family that is surrounding the baby, there is often very little. There is a lot more that is going into support on the units, and a lot of units now have a psychologist. That wasn't the case when I had my baby at all. So over the past few years, there are more psychologists on the unit, which is great, but there is such limited funding for the bit afterwards. So in an ideal world, it would be that parents were followed up and supported with that kind of discharge support for that first, however long after kind of parents are home. But that's very rare at the moment.
Okay. Because you have a membership, don't you, with Miracle Moon? Like people can pay to be part of a community, which I think is great.
Well, I guess we just wanted to fill in that gap.
Yeah.
And that was from a kind of personal experience as well as a professional. Like, I just wanted to talk to other people who got it. I wanted to have other people who were to go, yeah, I have that thought too, or I've got that feeling too. But we wanted to take it one step further than just being a community. And we wanted to kind of go, actually, this is a group of people who need a very specific kind of support.
Yeah.
So we wanted to do things like information and resources around things like health anxiety that is specific to kind of neonatal care, or PTSD. So we've got a whole bunch of resources within there. We've also got a bunch of specialists who all specialise within neonatal care, OTs, physios, lactation consultants who are there.
Amazing.
So it's a membership that can be used whilst you're in neonatal care, but it also is supposed to be there to hold your hand months, years down the line. And we've got people in there who have got 5+ year olds who still want that support.
And are still getting lots of value, it sounds like.
Yeah, exactly. And it's just making it so that it's available to as many people as we possibly can do, which is what we're trying to do at the moment.
Yeah. And you talk on your Instagram a lot about loss and grief. And a post that caught my eye, you were talking about like too many firsts are taken away from parents. Can you say a bit more about that?
Yeah. So it's that feeling of the experience of being in neonatal care kind of taking away those first moments in so many capacities. So, for example, with me, it was that bit of it not just taking away the first, but so many of the moments that I expected. So I expected to have a baby shower, to have the big pregnant bump, to do a birth plan, to go to an antenatal class, to do all the things that you kind of imagine doing within your pregnancy. And that all kind of got taken away by having my baby early. But then I didn't have the birth experience that I wanted. I didn't have the golden hour, which is often quite a big trigger for a lot of people, that they didn't get that contact with their baby straight away afterwards. The feeding experience is different, and you're often not there for the first feed, the first nappy change. You're often separated within that. They're taking your baby home. You're often going home without them. There's so many moments, and it's not just in the NICU. It's then you get home and you do things like going to a baby group, and it's like, this doesn't feel how I thought it was going to feel. I feel like the odd one out here. Or you're spending so much time kind of wrapped up in your mind and in your mental health that you're like, I'm not feeling that joy. I'm not feeling that presence that I'm supposed to be having. My maternity leave is going. I'm going to loads of medical appointments. So I'm not having the maternity leave that I wanted. Or even then the birthday, for example, that first birthday, you're like, I wish it was just joy and it was just excitement, but it's often a trauma anniversary as well. So that feels like it's getting taken away. So there's so many moments that feel like they're missed. And I think when your expectation is kind of at a certain level, what you expect to happen or what you wished would happen, And then the fall is so far from that. I guess that's the bit where grief exists, because you feel like, I so wanted that. And the most common thing that you see is that people come with jealousy or resentment towards other people, and often reframing it as being like, under the surface of that is probably grief, right? It's the fact that they had what you wanted, and that feels really, really sad. And that for people feels like a bit of a light bulb moment, I think, by kind of labeling it as grief rather than that feeling of like jealousy, which can feel quite nasty or tricky to kind of have.
And the profound sadness, right, that comes
huge.
along with that. And as you say, like, I think, with your first baby, obviously, you don't really know what to expect, but you have this sort of idealized image in your mind, I think, of what it's going to be like, don't you? And I imagine for second or third time parents who have a baby in NICU, that must be very tricky as well, because they may have had a sort of, inverted commas, normal birth and everything went smoothly, and then they have that experience. So it's very nuanced, isn't it?
Completely. And you do get people who it's obviously different kinds of feelings for people who have, because then they've got the siblings at home as well, and that's another level as well. But it's it's so much around that bit of being in NICU and being like the stuff that did happen, but it's so much also about the stuff that didn't happen, which is a real huge thing.
Absolutely. And if we're thinking about a parent's time actually in NICU, and you said a little bit about it there. I think I've never experienced it. So just as you say, the kind of the beeps and the machines and the noises and the hearing other parents crying or I can imagine how difficult it is just being in that space, let alone sort of thinking about your own baby. Can you sort of offer some sort of tips on, like, if someone's listening and they haven't come across you before and they are a NICU parent and they're there at this point, like, how can they cope with that environment, with that experience? Before we get back to the episode, I have got something really exciting to share. Our brand new Substack community. This is a space where you can peek behind the scenes of the podcasting process and have a space to connect with other fans of the show. As a subscriber, you'll get a monthly roundup of all the episodes in that month, plus my thoughts and personal reflections on each one, completely free. But if you want to go deeper, a paid subscription unlocks exclusive perks like never heard before guest mini episodes, subscriber only chats, digital downloads, and even the chance to shape future episodes. If that sounds good to you, head to the Substack link in the show notes. Now let's get back to the episode.
I think that first bit, and for me, it was big of kind of just acknowledging that this is really, really hard, that this is even traumatic. Like, NICU is often in a crisis situation, and it is okay to feel however you feel about it. So I think that was the first thing, because I remember having some thoughts that felt really shameful, really dark, really tricky. And I remember being like, what's wrong with me for having these thoughts? Whereas if I'd had someone else to say just that, and just kind of do that validation, just go like, it's completely understandable to be having the thoughts and the feelings that you're having, that in its own kind of removes some of that shame. So I think that's the first thing. I think you have to do that bit of just taking it a moment at a time. They often talk about the fact that NICU is like a roller coaster, and it is, because you have maybe a little bit of time where things seem to be going well, and then it feels like they're not going so well, and then it goes back to being okay, and then it doesn't, and it just kind of goes all over the place. And for some people, that roller coaster is more vicious, and it can feel like whiplash when you're in that situation. So sometimes you have to go down to being like a moment at a time. So not even like a morning at a time, it's like a moment at a time, and just take it as it comes, rather than kind of letting yourself shoot forward into worst case scenario, which again, completely understandable that your brain is doing that. But coming back to the kind of present moment bit is really, really important, thinking about what you can do. I also think finding kind of micro moments of control is really important because it can feel really out of control. So there's so much that's decided for you. But if you can do small things like choosing which book to read to your baby, or choosing which like sheet or blankets or stuff like that you use, or getting involved in their cares, looking after them, so like changing nappies, doing oral care, stuff like that, that can really help you rebuild that sense of control and kind of feeling like a parent when it all feels so medicalized. And I think that like the bonding experience looks completely different in NICU. And so many people think that they can't bond, or that the only thing that they can do is produce milk. So there's a huge focus on producing milk when you're there. And for some people, it's not that easy. It's really, really difficult.
Well, if you're very stressed, if you're feeling, you're going to be stressed. And that is going to massively impact how you produce milk, or maybe not even make it so that you're not producing, right?
Exactly. And, you know, like with me, it was that kind of emergency section. And then my body's supposed to know how to produce milk, like having a baby 2 months early. Like, of course, it's not going to and it's not got the oxytocin and stuff like that. Instead, you've got the cortisol that is kind of preventing that milk production. So it's hard to do that, but there is such a huge focus on the milk there.
Do you mean from the medical staff?
From the medical staff, it's this huge focus of, this is the most healing thing that you can do. This is the most important thing that you can do.
So no pressure then.
No pressure then. I remember a doctor saying to me about, like, if you can produce this milk, then your baby's IQ will be higher. He will get GCSEs.
Oh my!
I just remember being like 2 days out, like completely dissociated, being like, oh, okay, like that's what I've got to do. But there are so many other ways that you can bond too.
Yeah.
Like we said, kind of reading, talking to your baby, just being with them, thinking about them, looking at them, touch. If you can't physically hold them, because sometimes you can't, putting your hands in the incubator and doing things called containment holding, doing things that allow you to feel soothed, all of that kind of stuff is really important. And then I guess the last bit is having an outlet in some kind of ways. So you're often sitting there by the incubator on your own, and you're just in there with your thoughts, and, you know, having that connection with other people, or having an outlet, a journal, voice noting it, getting it out in some kind of way is really, really helpful. And again, that's a huge reason why we've got the NICU space, as a way that people can do that and have people connect with them back as well. But yes, I guess they are some of the things that you could do to help.
No, but they all sound brilliant, and things that I wouldn't have thought of. The other thing that comes to my mind is, can you talk about some of the unique challenges that fathers or non-birthing partners might experience? Because I think often in sort of any sort of birthing experience, dads, non-birthing partners can sort of not be left out of the conversation a little bit. But I'm curious about what that's like, and whether you have any tips for them.
Yeah. So if you think about what normally happens for a dad, is the mum, the birthing person, gives birth, and then they are taken to the wards to be able to be looked after physically afterwards. The dad or the non-birthing person goes to the NICU with the baby. That tends to be what happens. So they are there with the baby, normally when the baby is the most medically unstable, when they are needing a huge amount of intervention, trying to stabilize the baby, and the dad is there on his own, kind of in the NICU on their own. The majority of, you know, NICU staff are absolutely incredible in supporting and reassuring and giving information. But from working with loads of dads, it's that bit of going like, I felt really alone. I felt really responsible. I felt really torn of being like, I should be with, my partner, but I should also be with the baby. And this feeling of like, I have to stay strong. I have to be the rock. I'm not allowed to let my partner see that this is hard. You have to go back with pictures and be like, they're okay, or delivering the news, making sense of it. But they're traumatized too.
Yeah.
They've been through a huge amount, even if they're just witnessing it. There's a huge amount of trauma as a result of that, just standing there and feeling quite helpless, I guess, within it, and quite powerless. And from a lot of dads that I work with, it's that bit of going, I want to fix, I want to make this feel better in some kind of way. And you can't in those kind of moments. It's really very difficult. I think for a lot of dads, non-birthing partners, we see that when they get home, it's that bit of going, maybe feeling quite disconnected. They still experience all of the same perinatal mental health struggles, PTSD, anxiety, depression, all of that. But maybe it shows up a bit differently. So you might see kind of quicker to anger. You might see that disconnection, maybe throwing themselves into other things, work, for example. They might have to return to work while their baby's still in neonatal care. Maybe just not wanting to talk about it. So a lot of people kind of doing that bit of going, it's in the past. Stop going over it. We're not going to talk about it. It's that kind of avoidance kind of thing. Because I think quite often dads don't have that space to be able to voice how it is that they're feeling, either because their partner's going through a hell of a lot and they don't want to burden them with it, or that there isn't the space created there for them to be able to name, process how they feel, but they do feel it all too.
And I'm guessing, do you, in terms of the work that you do you see mainly women or the mums?
Mainly,
Yeah.
So it's mainly women. The majority of the time, it's that two people will turn up together.
Okay.
And then it will be like, well, actually, he needs a little bit more support. And then I'd see him a little bit more. But very rarely do I get a dad just approach me on his own. It has happened, but the majority is like they come together. And then it's kind of like, oh, actually, it's him who needs a little bit more support.
So there's still work to do there, isn't there, in terms of the kind of societal norms around men's mental health and seeking support.
Huge.
And
Yeah. I mean, even the fact that perinatal mental health services, it should be men and women, it should be, right? It's just that bit of, it's just not spoken about enough. And, men need so much of that support. They struggle with so many of those things, and we just need to be talking about it.
Yeah, absolutely. So can you tell us a bit about once you've got baby home, what have you seen in terms of, and your experience as well, of sort of how the NICU experience shapes your parenting or your parenting experience? Because I imagine from what you said today, quite apart from the mental health challenges that show up, I imagine it's incredibly difficult to settle into kind of normal family life once you've had an experience like that.
Yeah, and I think it's just that. I think it's like you are still holding your breath after discharge, right? You don't get home and you're like, thank God that's all over and it all feels good now and we're safe and we're home and all of that. Like, the trauma of the experience still stays with you. It, like we said before, it's gone from having that medical team 24/7 watching your baby to them being completely on your own. And there's a huge mix of emotions in coming home, where a lot of people assume it would just be excited. Yay, great, this is what you've wanted. But there's a lot of anxiety around it too. And then it's a real adjustment period, because then you are doing it on your own. So we see a huge amount of anxiety, particularly around health, making sure your baby is okay. For me, I just remember that bit of just not being able to sleep because I was just watching constantly, making sure that he was breathing. And it was that bit of just going, if there were any colds, any kind of illness or anything like that, just so hypervigilant, because those colds often landed your baby back in hospital. There was often, because their immune system isn't strong enough, their lungs aren't strong enough, all of that. So there is a real threat there,
Yeah.
as well as that kind of perceived threat too. There's anxiety around things like milestones, because the conversations that you have in the NICU is, we're going to watch and wait for the next 2 years to just see how this impacts your child developmentally.
Okay.
There might be other issues that you're looking out for, like babies have a lot of brain bleeds and things like that in neonatal care. So you're kind of waiting to see what the impact of that would be on your child.
Okay.
So it's a lot of, is that milestone happening? There's a lot of comparison there. There's a lot of kind of worry around it. And I think that a lot of parents become anxious parents, and they go, well, is this just how I am? Am I just an anxious person? Would I be kind of overprotective or overcompensating for things, or really worried about them all the time? But from the work that I've done with people, it doesn't have to be like that. So you can reduce that hypervigilance, you can reduce that anxiety, you can process that trauma so that you're able to be the parent that you want to be, that's aligned with your values and how you want to parent and all of those kinds of things. Often it's that kind of holding on to that trauma and that anxiety of the experience that is kind of getting in the way of the way that you want to parent.
Yeah. Because even if you haven't had a baby in NICU, and it's particularly with your first baby, you are anxious, aren't you? And you are kind of looking out for signs of illness and things. But when you've had that experience in NICU, I mean, it's 50-fold the anxiety will be, won't it? And I imagine that parents find it quite difficult to let go of the hypervigilance, because obviously it keeps baby safe, right? Or keeps your child safe.
Yeah, exactly that. I think that there's benefits to remaining hypervigilant, especially at the beginning. And it isn't until, and that's why maybe we see people later on where they're like, okay, this actually is no longer helpful. Like, this is actually getting in the way of the way that I want to parent now. Actually, I don't need to be this hypervigilant anymore. That's when we start to go, okay, we want to get you to a place where you're vigilant, but not where that alarm system is kind of going off at every kind of point. We want it to be going off when we need it to go off. So that's the point that we want to get people to. And I think that that's where, with things like the health anxiety course and stuff, we talk about that. We also talk about exactly what you just said, that there is a normalness around becoming a parent in terms of that matrescence period and that identity shift and all of that, like your brain's being rewired to being more emotional and more in tune with your baby and more hypervigilant. Completely normal. But it's almost like, trauma trescence, like some where you've been through trauma and becoming a mum in some kind of way that kind of puts that matrescence bit on steroids a little bit. Like, it just feels so magnified and you feel like such a different person. Like, identity is a massive one for people, because it just feels like everything that they felt like they knew has just been shaken. And you become a parent all at the same time. So there's a huge amount to make sense of.
And would you say there are any sort of misconceptions about being a NICU parent, or the sort of mental health around a NICU parent that you'd like to sort of debunk?
I think the biggest one is that bit of, your baby's fine now, so you should be fine too. Or you're home now, so you should be okay. It's that bit of, from what we know about trauma, it doesn't end when the crisis ends. Like, it can continue. Your brain and your body can still be telling you that you are unsafe, that you're to blame, that, whatever it is, that you're not a good parent. And that is the trauma talking. And it's not about kind of getting over the experience or putting it behind you, which a lot of people kind of feel like they should be kind of months or even years down the line. It's that bit of kind of going, hey, this is how you feel. That is valid. That needs some exploration and maybe needs a little bit of time to get that help and support to be able to kind of help you with that, to be able to shift with it,
Yeah, absolutely. Thank you so much for taking the time. It's been a really for me personally, a really informative chat with you because as I said, I don't tend to work with people who've had that experience. So thank you so much for being here.
No worries. Thanks for having me.
Thank you for listening to this episode of Hello Therapy. If you found it helpful, don't forget to subscribe, follow and review. You can get more wellbeing and mental health tips by joining our email list and visiting the resources section of our website at harleyclinical.co.uk. The Hello Therapy podcast and the information provided by me, Dr. Liz White, is solely intended for information and educational purposes and does not constitute personalised advice. Please do reach out to your GP or a mental health professional if you need support. Until next time, take care of yourself.